Someone posed a question asking, how do you support a loved one or family member who has been diagnosed with schizophrenia? This is an excellent question for a variety of reasons, but primarily because social support is a protective factor when we're talking about suicidality and schizophrenia. According to the American Journal of Psychiatry, approximately 10% of patients diagnosed with schizophrenia die by suicide. So let's talk a little bit about it. First of all, let's talk about the difference between psychosis and schizophrenia. So psychosis is a syndrome. So this can occur in various mental health conditions such as bipolar disorder, depressive disorder, even neurodegenerative disorders such as Alzheimer's or Parkinson's disease. And it involves a loss of touch with reality, leading to hallucinations, delusions, and disorganized thinking. People who are experiencing psychosis may really have trouble distinguishing what is real from what is not. Schizophrenia is a chronic mental health disorder that's characterized by disturbance in thinking, perceptions, emotions, and behavior. Some of the symptoms of schizophrenia can include hallucinations, delusions, disorganized thinking, and social withdrawal. And it can be very challenging for someone with schizophrenia to function in daily life without proper support and treatment. Some of that has a lot to do with compliance issues, which I could spend a whole hour discussing. But some of the reasons why people that have been diagnosed with schizophrenia are non-compliant is, for one, they may have a lack of insight and be in denial about the need for treatment. The antipsychotic medications they have to take can have very distressing and unpleasant side effects. And there's a stigma that's associated with any mental health disorder, nevertheless, schizophrenia. So they may be fearful of judgment or discrimination, which can prevent them from seeking treatment. And sometimes people will use this as a coping mechanism to regain a sense of control or autonomy over their lives when things feel out of control for them. So when you're dealing with somebody that has a psychotic disorder in your family, first you want to educate yourself about what's happening with them. Understanding this condition can definitely help you provide better support. You want to listen and validate and encourage open communication. Actively listen to what they have to say without judgment. Validating their feelings can definitely help you develop some trust with them. And you want to create a safe environment. You want to minimize stressors and triggers that may worsen their symptoms. And you want to encourage your family member to seek treatment. Offer to accompany them to appointments for support. Let them know you understand why they might be resistant to support, but show up for them because it matters, even when you think it doesn't.